Oh, welcome to the Aging Boomers. I'm your host, Frank Sampson. Of course, on our show, we discuss so many of the issues facing boomers, their parents, and of course, what is an aging population today. And before I introduce our guest today, I'd like to remind everybody that today's show is sponsored by Senior Care Authority, a professional senior placement and elder care consulting organization that has a national network of advisors to help in determining the right path for senior living and receiving proper care. So whether it's in-home care, assisted living, residential, or memory care, get the necessary advice from a senior care advisor in your area by calling Senior Care Authority at 888-809-1231, or you could go directly to the website at www.seniorcareauthority.com. So I want to, again, as I always do, thank all of our listeners. Thanks for tuning in. Thanks for letting friends and family and associates know about our show. Our listeners are growing each and every day. Of course, you can listen to the show on iTunes, iHeartRadio, Spreaker, Stitcher, all sorts of online stations. But of course, many of you have just downloaded our free app, which is called The Aging Boomers, that you can get on your iPhone, Android phone, iPad, etc. And we'll keep you up to date on all of our educational shows. So thank you so much for all your support there. So I'm always excited about our guest, but we're going to be talking about an important subject. I have with us today David Cronin. David has been involved in the elder care institutional services for 47 years. I won't ask your age, David, don't worry. He was born into the healthcare industry since both his parents were registered nurses, and they opened a highly regarded skilled nursing facility in Orinda, California in 1967. David received his hospital administrator's license and worked in that capacity until the facility was sold in 2014. Since that time, he has been involved with Indy Lift, a human floor lift designed to pick people up off the floor and avoid injury after a fall. So, David, thank you so much for joining us on the Aging Boomers. I really appreciate it.
Well, thank you so much. I'm very, very happy to be here. Yeah,
so, we talk about falls or prevention of falls quite often, David, on our show. It's just, to me, it's an extremely important subject matter, and we can't talk about it enough. But, though you have spent quite a bit of time, not only in fall prevention, but in an area that you've referred to as fall recovery. So tell us more about fall recovery and kind of compare the two between fall prevention and fall recovery.
Well, thank you. As you mentioned, I've been involved in the institutional setting of elder care for 47 years and dealt with hundreds of falls and lifting people up who couldn't get up off of the floor. And it's amazing how common this problem is, and indeed it's growing. And so, though fall prevention is crucial, and there's been a great deal of emphasis on it, fall recovery is obviously very much a part of the equation. And really until fairly recently in history, we have not had mechanical means of getting people up off the ground. And indeed, this problem goes back for obviously, since people were walking around in caves and somebody would fall down, and how do you get a person up who's elderly or injured? And now we have machines that can help get people up off the floor, and I call that fall recovery. And it is now getting much more emphasis on a legislative, governmental level. Workers' comp companies are insisting upon devices being used in hospitals, and it's very much a concern in the home, of course, for people who want to stay in their homes and not call the fire department every time somebody falls down and can't get up. So, as you mentioned, I'm with a company called Indy Lift, which is a very simple, it's a chair. It's a chair lift. The seat goes down to the floor. You wheel it over to the person who's fallen. They scoot their bottom onto the seat, press a button, and it lifts them back up. So it's one of those ideas that, well, why didn't somebody think of it before? Mm-hmm. What is happening now is that there are a number of different modalities that are available. Indy Lift just happens to be very simple, and it was the one that I got involved in. I can tell you a little bit about the history of it. But it's so exciting to actually have remedies for this situation and prevent back injuries and keep people in their homes.
I'm not sure people really understand the injuries that occur after the fall. Not not only to the person who had the fall, but to the person who is assisting them, in getting up. Can you talk to us about that? I mean, are there statistics, or give us your you've been at it a while, so share with us that information.
Well, the statistics are daunting, and they're readily available from many sources, but I could go on for quite a while with some of these, but there are things from OSHA, from the legislatures, from universities, the Center for Disease Control, et cetera, et cetera. Basically, what in the workplace, healthcare workers are at a higher incidence and risk of back injuries than any other profession. Ambulance drivers, nurses' aides, EMS workers, the emergency medical services, firefighters, and certainly nurses, CNAs, are at high risk for muscular skeletal disorders, MSD. And there are proven ways to alleviate that, which are now becoming legislated. And just very quickly, there's about 12% of nurses leave the profession annually because of back injuries. That's 12% of nurses leaving the profession annually. And about 20% of nurses choose to transfer to other work because of an injury. More than 52% of nurses complain of chronic back pain. And healthcare workers experience some of the highest rates of non-fatal occupational injuries. And manual patient lifting is the primary cause. This is a huge problem in the sense that we're looking at a shortage of possibly 500,000 nurses nationwide by the year 2050. By 2020, we're looking at about close to 300,000. So we desperately need to keep our nurses in the profession. And of course, the population as a whole is aging. The trend is towards the growing elder portion of the population. And there's the problem of obesity. Morbid obesity is becoming a situation where if somebody falls, it's almost impossible to pick them up sometimes.
Right.
The fact that, I'm sorry, go ahead.
No, go ahead. I was just agreeing with you.
Oh, it's astonishing. And so these issues are being addressed on many levels. The problem is recognized now. And the fact is that according to the CDC, Center for Disease Control, there's about 1 out of every 3 seniors that is over the age of 65 falls annually, which is kind of an amazing statistic. I'm going to be 67 in December, and I do my Tai Chi and Qigong and my fall prevention basic health stuff, but the thought that such a high proportion of people falls, and of course as people get older and the physical changes occur, then the likelihood becomes higher. In a skilled nursing setting, 50% of the patient population falls annually. And the tendency is for somebody who has fallen to fall again. That's when the patterns start, and certainly it can change people psychologically as well, where they become fearful of movement, and in a spiral they become less active, less socially engaged, and paradoxically become more prone to fall. So there's many compelling reasons for non-manual lifting efforts to be made. I just wanted to mention real quickly about the home. Caregivers in the home are equally, if not more, likely to get hurt. As a matter of fact, when you talk to almost anyone, I'm always startled. Almost anybody that I talk to says when the subject of patient falls comes up, they say, "Oh, my grandmother has a falling problem," or "my aunt," or "my neighbor," or so-and-so, or "I wish I had known about these machines for the home before my mom died," et cetera, et cetera. There's not just the danger to people in their homes, and everybody wants to stay in their home. That's sort of a given. But when there's not a system in place, as there is in a hospital, when somebody falls and they can't get up, the options are very limited. You either try and pick them up, the spouse or the family or the neighbor, or you call the fire department. Call 911, and they either send out a fire truck, emergency vehicle, or a contracted ambulance company. Incidentally, the ambulance company people have a 6 times higher rate of back injuries than the national average, because they're often the ones that do lift calls. So in the home, and again, this is amazing, just within the last week, I spoke to 2 people whose parents, in both cases it was the father, were injured severely trying to pick up their spouse. And in one case, it was a person whose mother-in-law had been in my hospital for about 3 years. So over a period of time, you get to know the family. Well, I ran into this lady recently, and her mother was falling, and her father tried to pick her up from the floor, and he blew out his back, had to have surgery, and he said to his daughter, "When I went to pick up your mom, I felt like I was 18. Afterwards, I felt like I was 80." And it changed his life. So
right.
We're trying to avoid injuries across the board.
So you mentioned legislation earlier. So why is it that why is the government so involved in giving more attention to this? How has that occurred?
Well, basically, as many of these things happen, it's driven by cost. The estimated cost for healthcare workers out each year on injuries, and over 50% of the injuries are back injuries, and most of those are due to patient lifting. The estimated cost is over $20 billion a year. So, and the lost hours, the costs to a facility when a caregiver in a nursing home goes out with a back injury, the average cost is $18,000. And that is not counting overtime. That's strictly the workers' comp and bringing in a new nurse, like an RN or an LVN who has gotten hurt and has to be replaced, the replacement cost can be anywhere from, they are, according to these figures, $27,000 up to $100,000. So they're trying to keep people in the workforce, and the emphasis now on mandated lifting devices is strictly to alleviate this pandemic, if you will, of injuries to caregivers. Of course, it applies to the patients as well. When you're using one of the old sling devices to lift somebody off the floor, which certainly has its place, or a manual lift by 2 or 3 caregivers lifting somebody up off the floor, it can be brutal. It can be scary. It's undignified. People get skin tears. They get hurt. And certainly there's body mechanics that are taught for manual lifts. And there's a place for all different kinds of machinery, including ceiling lifts in the acute hospitals, which are becoming more common. But that's why the legislatures and insurance companies, et cetera, are pushing this. I should mention that in 2015, for OSHA, they have actually established guidelines for inspectors that involves looking at required lifting teams and policies, and they're going into the realm of requiring lift devices and equipment. There's 11 states that have enacted legislation requiring lifting policies, and 6 or 9 of those states have requirements now for lifting devices. Congress actually, the House of Representatives passed a law in 2013 that required OSHA to start working on this, and that's why in 2015 they came out with these new inspection guidelines that are going to be applied to all the states. And in California, there is one of the states that has required lifting policies and safety devices, and actually in 2012 they added a section to the labor code, which is 6403.5, which requires hospitals, it doesn't apply to nursing homes yet, but hospitals to have lifting policies and equipment that are used in prescribed manners. And it also allows caregivers, if they're assigned to pick somebody up and they don't feel that they can and there's not equipment available, they can refuse to pick that person up without repercussions. They're protected now by law, and to say, I can't pick this person up, it's unsafe to me and to the patient. So the states still have a lot of leeway at this point, but the legislation is coming into play.
Yeah, I mean, it varies state to state, of course, but as you know, my business, I'm quite involved with assisted living and memory care locations, and many of the states, they don't allow a caregiver to pick somebody up. They must call 911.
Well, that is a classic conundrum, and we've run into that with Indy Lift. And the problem is when you have an assisted living, for example, situation, which has become more and more prevalent, and they don't have medical personnel on staff, then doing an evaluation of a fallen person is problematic. And the ownership of these often large chains say, no, you cannot pick somebody up because there's the chance that they've hit their head and might have a brain injury or a bleeding that we can't diagnose, and the patient, especially if there's some dementia involved, might not be able to communicate. And all it takes is that one person to have a severe accident, and we're liable. So I've talked to people, a number of places where the administration, the people on the ground in the building, take a look at an Indy Lift, this chair lift that almost eliminates the problem of getting somebody up who's not severely injured, and they go, yes, we want that machine. And then they go to ownership, and the ownership says, no, there's too much liability.
Right.
Now, what we're looking at, and some of the fire department people recommended this, is we're hoping down the line that the state will initiate some sort of an educational program or certification so that people can attend a class, and maybe a day-long or 2-day class of being able to evaluate a fallen person and be certificated by the state, and thus hopefully prevent some of this fear or alleviate some of the fear of lawsuits or liability. And the fire departments are telling these facilities, the assisted living ones, you have to start picking people up, because we cannot, 75%, 80% of their calls are to get people up off the ground who have fallen and can't get up. I've been to places where they basically were calling the fire department every day.
Right. And
the larger facilities, including one of the facility that bought our hospital model of they have 300 people in residence. It's a CCRC, a continuum of care retirement community, all the way from skilled nursing down to the independent and assisted. And they had fire department coming almost every day to pick somebody up. They had medical people that can go and look, but they were having a fall a day. In another place that had 180 beds, they wanted to get an Indy Lift, but the ownership wouldn't allow it. So you're very right. It is a conundrum. And the fire departments are, for example, in Oakland, I believe they're starting to charge $500 a visit to pick people up who, when there's a repeated call, and they've been telling them, you have to start getting people up off the floor. Now, the other thing is you'll get people who fall for repeatedly. For example, another facility I went to, the administrator loved the idea. This was a standalone place, and the ownership, again, would not let them buy a machine. And she said she has one little old lady who falls for fun. She just likes to fall down, and it's entertainment, and these big, handsome firefighters come and pick her up. And so, it's pretty amazing. But we're trying to address that.
I want to make sure, David, that we leave enough time here. Tell us just some of the innovation. I know we mentioned Indy Lift. You certainly can explain that, but tell us about the innovation that's being done today in regards to this, important matter.
Well, certainly. What has been evolving since just really in the last 100 years, where you're starting to get mechanical devices, and we got the sling hoist, which basically is the Hoyer Lift or Medline or Vancare. There's different companies where the person, and everybody's familiar with this, where you roll the person onto a canvas sling, and then there are chains, and it's hydraulic, or it used to be a manual crank. When I started out in 1967, we had devices that you just turned the crank and you raised the person off the floor like you're hoisting a horse off of a ship. And we tried to teach body mechanics, and you can only do body mechanics so much. The CDC recommends don't lift anything over 51 pounds. Well, the caregivers, their instinct is to help to lift people up. So it doesn't always work. So along with the Hoyer lift, which gradually became more sophisticated, and those lifted devices, there have been more recent attempts. There are inflatable devices. There's one called the Camel, which I think started in England. There's another one called the Elk, and the Camel is sort of a full body chair almost that inflates up in layers. And I've talked to people who have used that. They use it a lot. It's big. It's when it's fully inflated. For example, that's one of the disadvantages. It's hard to get in between beds, for example. The Elk is just a pad which rises up almost like a stool under a person, so you have caregivers there steadying the person. There's another new product out of Denmark, I believe it is. It's called a Razier, which I think is fairly new. It's almost like a snap-together Lego type thing that you roll the person onto their side and you put the back in, you roll them back and you click everything on, and it has a motor and it gradually sits people up. Really, by far the simplest, and the reason I'm involved in it with Indy Lift is it's just a chair. It's intuitive. People aren't scared by it. It's silent. It'll pick up over 500 pounds. The EMS model and the hospital models will pick up 550 pounds. They'll actually pick up more, but we've rated these things to be super safe. We have 400-pound models. And the ones for the home, there's a HFL, they're called human floor lifts. There's a 300B, which has the battery, and that's rated for 300 pounds. We have a 400 rated for 400 pounds. And these are just like dolly, almost like a carry-on bag. It has two wheels. You tilt it back like a dolly almost. You wheel it over to the fallen person. You help them to sit up. Then they scoot their bottom. You put the chair down to the floor, the seat, and it's almost like a dustpan shape, and the person scoots their bottom onto it. You press the up button, and it lifts them up to the ADA, American Disabilities Act, limit of 21 inches. The arms are removable. A person can slide onto a wheelchair. The heavy-duty EMS models, which are on fire trucks now, the firefighters love them, and they can actually be used to move people around. They have safety belts for the chest and the waist. So there are different machines that are coming out. It just so happens that, in my opinion, Indy Lift is the simplest.
So how can people learn more about Indy Lift website and anything you'd like to share with our listeners?
Well, first of all, the Indy Lift was developed by a gentleman, Steve Powell. It was invented by him a couple of years ago when his father kept falling, and they were calling the Livermore Pleasanton Fire Department 3 and 4 times a week. Steve came to me. He knew I was in the long-term in healthcare and told me about his idea for a chair to lift up a person like his father who was heavy, and he couldn't pick him up. And I said, it's brilliant. It's so simple. So he came back to me about 8 or 9 months later and said, I did it. I built it in my garage, and he did. And then we got a local manufacturer company to start building it, and the firefighters got very excited, and they started doing input. And so here we are a little over 2 years later with patents pending worldwide, 4 models, and it's spelled INDEELIFT. So Indy Lift, INDEELIFT.com. You can go to the website, or on YouTube are the more recent videos, short videos, testimonials from the hospitals, from the fire department people, EMS, emergency services, and training films, etc. So we're still a relatively new company, and we've refined the machines over the last 2 years, and now they're ready to go.
Great. Well, David, I really appreciate you taking the time to be on the show, and it's an important matter, and I wish you and Steve and the entire group at Indy Lift all the luck, I think, in the world. It's certainly needed. So check it out at www.indylift.com. And hopefully, David, we'll have you back in the future. Give us an update of how things are going. All right?
Well, thank you so much, and I really do appreciate it, and I think what you're doing is wonderful as well.
Great. Well, thank you so much. And I want to thank everybody for joining us out there. Just be safe, and we'll talk to you all soon.